Do your eyes hurt right when you wake up? Like a sharp pain or maybe like a gritty sandpaper kind of a feeling? It's super common, and it doesn't intuitively make sense because you'd think that your eyes would hurt at the end of the day, not when you first wake up. Let's go through the reasons this happens and what you can do to fix it.
Red eyes in the morning.
Now, something really important to understand is that even when your eyes are closed, your tear film can still dry out while you're sleeping. And this is especially true if your room is really dry, or if you're dehydrated, or if there's airflow, like a ceiling fan or a vent blowing on you. When the tear film dries out, you get little dry patches on the front of the eye, and it feels kind of sandy or painful. This is the most common reason people have irritation when they first wake up. This is made worse if the day before they were looking at screens all day, or maybe they were outside all day in windy weather, because then there's a lot more corneal damage. And that corneal damage needs to be repaired. Your eyes are most active repairing themselves while you're sleeping. So if you wake up and you interrupt that repair work because there was so much it couldn't finish, then you're going to be particularly uncomfortable and you'll have irritation right away. So the more obvious solution here is don't let your eyes get that dry to begin with, which sounds easy, but in practice it takes some lifestyle changes. So you need to make sure that you're drinking a lot of water throughout the day. Stay well hydrated. Use lubricant drops, particularly try to use preservative-free lubricant drops. I really like the ones that have glycerin as an active ingredient, and they're real common. You can find them in all the Refresh brands. You've got Refresh Relieva, also the Optace brands. I'll put some links to some of these in the description, but these ones are really common. They work well, they got a great track record, and they slow evaporation of the tears, so you get a little extra protective barrier. If that's not enough, if you're using lubricant drops like that 4 or more times a day, there are a lot of prescription options. Come in, get an eye exam, let us look and see what we can do to prescribe you something. There are great treatment options that I've talked about before, like IPL and Tixel. There's just a lot that can be done, but all of these things are preventative measures. There isn't like some magical pill you pop or medicine that you take to fix it when it's happening. You need to kind of think ahead. Along these same lines, there's a condition called Lagophthalmos, and that's where the eyes don't fully close or they don't fully stay closed while they're sleeping. It might just be a tiny sliver of the eye that gets exposed, and maybe for just a little bit, but if you saw my other video about what happens when you don't blink, you'll know that it doesn't take very long before you start to have some pretty significant damage if your eyes are exposed to the air without blinking. When I look at people's eyes and they have this, I'll look at the cornea and I'll see at the bottom 1/3 of it, there's this area of dryness. Most people are pretty surprised that this is going on because you can't feel that your eyelids are open while you're sleeping. Lagophthalmos is especially common for people who have sleep apnea. It's just a common correlation. So sometimes there's a little extra laxity to the upper lids. Other times they just don't fully stay closed or they open a little bit. On top of that, having a CPAP machine usually dries out the eyes too. That little seal will sometimes break and that moving air will dry out the eyes. Even if it doesn't break the seal, it dries out the nasal passages. And I found surprisingly that even if you have one of those fancy ones that has the moisture tank there with the water in it, those still seem to dry people's eyes out. And so in the morning, they just feel more uncomfortable. We have a dentist in town that specializes in making the mouth guards for people with sleep apnea. So you can look into finding one of them. That can work really well for some patients. It's important that you do get your sleep apnea treated, but we don't want to do it at the expense of your sanity and eye comfort. You can also put ointments in the eyes. Lubricant ointments like Refresh PM work really well. They're a little bit goopy, so it's a little bit of an annoyance, but if your eyes are really uncomfortable every day, it can be worthwhile to do it. There's also these new eyelid taping ways. You can put this over the eyes and it keeps your eyes from opening at night, and that can work really well for people too. Not Loctite. I think it's sleep tight, not Loctite. Loctite's different. Don't super glue your eyes shut. One keeps your eyes shut for the night, one keeps your eyes shut forever. If you want to check yourself out at home, there is the very simple partner test, which is where you just ask someone who has the legal right to see you unconscious to look at you after you've fallen asleep and to see if your eyes are open at all. If they see even a little sliver of white, that's Lagophthalmos. If they look at you and it looks like you're creepily staring at them in your sleep, then that's probably Lagophthalmos, but you could have been possessed by a demon. And there are ways to fix that too, but that's a different video. Now, when talking about dryness, I have to mention specifically Meibomian gland dysfunction, which is kind of a category of dryness, but it's super common. So the Meibomian glands are the little oil glands around your eyes, and if they're not functioning properly, if they're making poor quality oil or if they're clogging up, then you're going to have tears that evaporate too fast. You're going to have more inflammation on the front of your eyes. So to help address this, it's really helpful to have warm compresses that you use right before bed. About 10 minutes of heat at night over your eyes. It'll help you fall asleep anyway, but that clears those little ducts out. There's also a lot of research that high quality oral omega-3s are really helpful at both improving the quality of the secretions and reducing the amount of inflammation on the front surface of your eyes. If the pain is particularly sharp when you wake up, like someone stabs you in the eye with a needle and it kind of lingers for a while, then it could be what we call a recurrent corneal erosion. It would be a mild one. A severe recurrent corneal erosion is so painful people can't function, so that always leads them to come into the office. But a mild one might be kind of a painful stabbing or sharp pain, and then after a half hour or an hour, you're getting better and you're kind of doing things, but it just is obnoxious and really bothers you. These happen because the surface of the cornea dries out a lot and it's not well connected to the deeper layers of the cornea. So that dry cornea that's kind of loose sticks to the eyelid, and when you open your eyes, it tears the skin off. It hurts really bad. Not surprisingly. So to treat this, it's a lot of what we talked about already. You got to keep your eyes real moist. Don't let them dry out too much. But specifically a lot more ointments at night. So Refresh PM or Sustain nighttime ointment, you want to put those ointments in the eyes, keep that front surface slick so it doesn't stick to the eyelid. But along with that, there are hypertonic solutions and ointments, and those can really help because they pull this moisture out of the eye. While we're sleeping, there's a normal swelling that occurs that can kind of loosen the bonds of the cornea, making it more likely that those tears happen. So these hypertonic solutions, they will have an osmolarity that will pull the fluid out, and that's going to strengthen the bonds, making it less likely that you'll have a recurrent corneal erosion. Usually I will have people use the ointments in their eyes at night. That's just going to work better for this type of an issue. It does sting a little bit when you're first getting used to using it. So for a week or two, you'll feel like it kind of stings, but after your eyes get used to it, it won't sting anymore. So just hang in there. That can be a real helpful thing to have. I'll leave a link to that in the description also so you know what that is. And finally, allergies can also be a big component of this. So you'll wake up and you'll have some redness and irritation and some itchiness. Usually itchiness is in there too. Itchiness and allergies usually go hand in hand. So if there's no itchiness, think of the other ones. If there's some itchiness, then allergies might be a big component of it. While we're sleeping, we have much lower concentrations of an enzyme that breaks down histamine. It's called diamine oxidase. And because we have less of this, the histamine in our bodies builds up. And so we could wake up with more of these allergy symptoms even though we've just kind of been in bed. So look for that. If you're having more of that itchiness in the morning, then the key would be to put in some allergy eye drops at night. There's some good antihistamines that are over the counter. Pataday became over the counter in 2020. It's a great one. The key for that would be to use the extra strength one right before bed. Since that histamine's building up while you're sleeping, do it before bed so that you'll have the best shot of waking up without that itchiness there. A couple other quick things to mention. I think it's not a bad idea to add some humidity back into the room, so consider humidifiers. I think they're a little bit of a pain personally, but people have found some success with them. It's mostly adding the distilled water. You gotta do distilled water, you end up with a little white film on everything. I had a patient recently though who said they bought a little distilled water maker and they said that worked really well and it saved them some money, so you could consider doing that. In addition, look at your sleeping situation, see if there's moving air blowing over you. So you could redirect vents, check your setup with a ceiling fan, see if you can find something that would make you comfortable but also not have air blowing onto you. Stay well hydrated throughout the day. So obviously you can't drink a bunch of water right before bed, but plan ahead and drink a lot of water all day long so you can have everything you need. If you're a little bit dehydrated, the Meibomian glands do not secrete a good quality oil. No matter how good everything else is doing, you gotta have enough water in you. Hopefully this has been helpful for you. If you have any other questions or concerns, please leave a comment for me. If you are interested in learning more, go ahead and subscribe. I have some upcoming videos about the gut allergy effect that can cause some similar morning issues. I'm going to delve a little bit more into that, and also the most common question that I get. So those videos will be coming out soon. Make sure to subscribe so you can know about when those come out. Thanks for watching.